Hello, everybody. Recording live from somewhere.
Welcome to the Dental Efficiency Playbook. Here we go.
Hey, party people, welcome to the Dental Efficiency Playbook. My name is Gabriel Hofmann, also known as the Dental Efficiency Guy, and I'm really excited today to introduce you to Dr. Rishin Shah. This is a little bit different of a spin, but a really important conversation, not only inside of dentistry, but medicine in general, healthcare in general today. Which is really on two areas: integrated or cross-platform collaboration and for optimal health outcomes, as well as sleep, the treatment of obstructive sleep apnea. And so Dr. Shah has an interventional cardiology practice in Dallas, and I'm excited to speak with you today, Dr. Shah.
Thanks for having me.
Yeah, can you take a few minutes and share with our listeners, how you arrived and the conversation we were having prior, really on how you have integrated sleep, the treatment of sleep or obstructive sleep apnea in your practice?
Sure. So, like you mentioned, I'm a cardiologist and have had my own practice going on for about 8 years now, and sleep apnea is very prevalent, but very underdiagnosed. And the major downstream effects of obstructive sleep apnea are cardiovascular. There's significantly increased higher risk of heart attacks, heart failure, hypertension, sudden cardiac death, stroke. And that is very underemphasized. And, when I'm trying to educate patients about obstructive sleep apnea, the title of the disease process does not say the word heart, cardiac, cardiovascular anywhere. And so many times I get pushback that my sleep is fine. But once I educate patients about sleep apnea and why a cardiologist cares, they're on board about getting tested. And so I've been a major proponent of testing for obstructive sleep apnea ever since I started practice. And especially in the age of home sleep tests, it's easy. They don't have to go get a polysomnogram and sleep in a facility overnight. But what I found was, referring out to sleep doctors, is that anytime there's any friction, the patient has to call another office, pay another copay or deductible. Just any friction, the compliance rate or the execution rate goes down significantly. So I first started by offering home sleep tests in my own practice, educating myself on it, talking to sleep doctors. I don't interpret them. I still have a sleep physician that interprets it.
Okay.
But I brought it into my own practice. And so obviously the rate of patients getting their sleep studies done improved significantly. But then I would still refer out. And then again, it would drop again. And so the next step was I started working directly with the durable medical equipment companies for CPAP. And at one point, I'd even hired a sleep physician in my office. And so that went better. And then I saw, wait a minute, CPAP is great, but there's a huge number of people that don't tolerate CPAP, don't want to do CPAP. Don't even go see the sleep doctor because they've heard about this big old mask they have to wear on their face.
Oh yeah.
So that, even though it's a great treatment modality for the people it works on, the rate went down again. And fortunately, because of the sleep physician we had hired, I got educated about oral appliance therapy. Never knew it existed, never learned about it in my internal medicine residency in medical school and cardiology fellowship. In fact, my sleep doctor said she got in her sleep medicine fellowship during her training. She spent a total of 2 weeks with a dentist. And so that was the extent of her education.
Wow. Okay.
So even those, at least this, N equals 1 experience, those people that undergo sleep medicine fellowships, they don't really get much education on oral appliance therapy. But then it opened my eyes, and actually through industry, there was a industry rep whose brother is actually a sleep dentist. He was selling sleep tests, and his brother was a sleep dentist. And so I learned more about oral appliance through him, and then talking to dentists. And then we started doing it, and then we decided, hey, I brought all this other part of sleep in-house. Let's bring the sleep dentist in-house as well. So we have a sleep dentist that comes and takes care of these patients that can't tolerate CPAP, decline CPAP, but have significant sleep apnea. And we've been doing that for about a year and a half, and it's been going great. These patients are now getting treated. There is a different modality that we can discuss with them. And from a clinical standpoint, that's great. But obviously also bringing all this stuff in-house is great for business too, right? It's another ancillary revenue source as well. So the patients are getting treated. We're taking care of the cardiovascular issues, and you're bringing them an income source. So it's win-win-win all around.
Yeah, three really really important points. I'm curious though, before I circle back to that, Dr. Shah, what is you mentioned the success rates, right, with the treatment, obviously the dreaded CPAP, in compliance with those, and then the home sleep tests, and that's how you got to oral appliance therapy. But what has been, obviously with the continuity of care, bringing a dentist into your cardiology practice, what have you seen as far as prognosis or compliance and success rates with patients?
Yeah, the compliance has gone up significantly. There is a cost associated, obviously, with oral appliance that can be significant. And so most medical practices don't offer like care credit and those sorts of payment plans. So we actually took a chapter out of the dentist handbook and started offering payment plans and things like that to patients. And so that's actually helped a bunch as well to get them to be able to afford these therapies. And downstream, obviously, it helps a bunch with their cardiovascular risk factors.
Yeah. No. It's really great. And again, I know we were talking before we got on here, or when we originally scheduled this, and I love that because prior to this point, I've talked to ENTs, pulmonologists, different people in medicine that are working with dentists, but you are the first cardiologist that I have spoken with about oral appliance therapy. So no, I'm really excited to hear that, and as you said, I think the two really important points. One is the treatment for the patients first and foremost, and the outcomes. Two, you mentioned the additional revenue source in your cardiology practice, as well as the cross-platform collaboration with dentists, and the dentist now coming into your practice, which I think are all really important points.
So, obstructive sleep apnea is very important from a cardiovascular perspective. The end results of sleep apnea is increased risk of heart attack, heart failure, stroke, increased risk of hypertension, diabetes, so many downstream cardiovascular effects. And so I used to always send out to sleep doctors, but as a dentist, you probably also know anytime you refer out to specialists, there's always a big drop off on the number of patients that actually get treated, right? Because they have to make another phone call and go pay another copay and see another doctor. And so I decided to bring it in-house, and so we started with doing some home sleep tests in-house. We then eventually got to, at one point, even hiring a sleep doctor for my cardiology practice, and then doing CPAPs. And thanks to me hiring her, I learned about this magical thing called oral appliance therapy. I never knew there was another way to treat sleep apnea other than CPAP and lifestyle changes, weight loss, those sorts of things. And even I was surprised that even during her sleep medicine fellowship, she only got 2 weeks with the dentist. So she had some intro to oral appliance therapy, but even she didn't use it much. And so I got intrigued, and I always want to do my own research and go to PubMed and read articles and those sorts of things. And so I found that for mild moderate sleep apnea, it's a great potential way to treat. So that's kind of how this whole journey started and how I kind of got started with working with some dentists. And I guess the next step was, I mean, I can keep talking, but like, you know, we started referring, same thing type of thing happened, trying to refer out to dentists. But again, there's a big drop off, and I found over and over and over and over again, anytime you bring stuff into the office, like the compliance rate and the acceptance rate is much higher. And I want my patients taken care of, right? The end results, it's always the communication about sleep apnea to the end results of heart attack is sometimes hard, right? Patients are always like, my sleep is fine, my sleep is fine. It's like, I always jokingly say, I don't care about your sleep. I do, but I'm a heart doctor, right? So
Right, but you know, couple important things that I think you just said that I don't want to breeze past. One, you mentioned the importance of bringing the provider into your practice for acceptance, right? Where you were referring out, and is the patient compliant? Do they actually go, right? And then the second being that the old adage of the first step is realizing that it's a problem, right? And do patients do that? I mean, I think if they did, then we would all have much greater treatment acceptance, at least in the dental field. I don't think people in medicine question the care the same way they do in dentistry, because again, you may know this, Dr. Shaw, but I don't know if all medical doctors do, but for whatever reason in the dental field, dentistry still to this day is perceived by a large percentage of the patient base as elective treatment, where, as we know, right, the oral biome, everything that happens in the mouth, right, affects the brain and the heart, and ultimately every other condition in your body, and eventually. And so, one thing that I'd love to touch on. Did you bring a dental provider as a visiting doctor into your practice then?
yeah, we actually have two now.
Two
So
dentists.
at
Okay.
my two locations, just based on where their own clinics are, because there are some insurance restrictions. So some patients, some patients will send to their clinic, and then some patients will schedule in our own clinic. And even differentiating between those, you can definitely see the ones that that we schedule directly in our clinic do show up way more and have a much higher acceptance rate um, of the oral appliance.
So how does the continuity of care work? You know, when the dentist sees them, you refer to the dentist, but does it go through a sleep study first and then go to the
Yeah, they
dentist?
already have so we do our sleep study, right? They already have a diagnosis of sleep apnea. Based on how
Okay.
bad it is, right? Mild, moderate, severe, we'll give our recommendations. If it's severe sleep apnea, we're always trying to get them on CPAP first. If it's mild, moderate, we discuss the risk, the pros and cons, risk and benefit, I guess. Because most patients are like, I don't want that big machine on me. Well, if you have severe sleep apnea, that really is the best thing, and I highly, highly, highly suggest you try it, right? Like, don't just say no because of this theory that it won't work for you. Because for obviously a lot of patients, it does work, and that's the ideal treatment.
Yeah.
And then just talking about,
Compliant.
yeah, right? So CPAP will always get your AHI, apnea hypopnea index normalized, basically, whereas it may not be as well tolerated for some patients. Oral appliance therapy is much better tolerated, but it may not normalize your AHI, right? We're trying to get for at least 50% improvement, or less than 5, which is normal. And it takes some time. You got to get it adjusted. It takes some time to get the device, right? All those sorts of things. And so I just talk about the pros and cons of each, and let the patient kind of decide what they want. Because in the end, if we really push CPAP, but they don't use it, or they don't proceed
Sure.
with working with the DME company to get it, well, it doesn't help anyone. So I'd rather have suboptimal treatment versus no treatment.
Yeah, of course, of course. So then, do you have the dental providers, or are the patients going to the dental clinic or dental practice
They
to have?
come they're seen in our office, so
Mhm.
there's a portable scanner. He brings his
Sure.
assistant. They scan in our office. The device is delivered in our office after a month. So everything's done in our office.
Okay.
For commercial payers. For the government payers, you're not allowed to bill out of physician's office, so they have to go to his office. And
Okay.
so for those, we just kind of send there. But we're very commercial heavy, just based on where we work. So the vast majority of patients do come to our office.
Okay. Yeah, interesting. Right. I'm always talking to my offices about not while we try to avoid insurance dictating care, but that's something where you obviously
And
have
then,
to.
and for people that don't know, this is all through medical insurance, right? Dental
Yeah.
insurance is
Oh,
not covered
correct.
medical
Correct.
treatment. So he is in network with, for example, traditional Medicare and a few other payers. From my understanding, it is hard for dentists to get in network with commercial medical insurance. So it actually turns out to be a lot easier to kind of bill out of
That
our
makes
office.
sense. The other aspect there is that a lot of dentists are intimidated by medical billing, and
Right. Yeah, no, I get that. I've seen all that all over online, and right for us, it's like it's so easy because we do it all day.
sure.
But I see there's so many billing companies targeted towards dentists because it seems to be much different. And I don't know how dental billing works, but yeah, I've definitely heard that from the dentists.
What I especially love this, Dr. Shaw, and I know I mentioned this when we spoke before the recording, but um, there's this movement now um, of whole body healthcare across providers that I think has more momentum than it ever has historically, and I love to see it. And you are a testament that to that, bringing dentists. I again, I have seen um, and work with practices and other individuals that train on implementing the treatment of OSA in their practices as both a practice builder as well as a life-saving measure for every patient in their potentially every patient in their practice, as opposed to the limitations on various types of dental treatments.
Yeah.
And with that said, um, there are still difficulties. Not every provider is engaged in doing it. I firmly believe, I think every practice in America should be treating obstructive sleep apnea in some capacity. There are those that are 100% in, and there are others that are, may not do any, but at least be trained and have the ability to do it on patients. It's going to improve obviously everything orally as well as their overall health outcomes, keep them around, which is the, they're raving patients forever when and their wives are and their family members are when you change their lives. Literally, they're happier when they're sleeping better. Their spouses are are happier. I mean, the list goes on about life changing benefits. And plus, it's a great. What is the rev share situation when it's billed out in your practice versus the dentist? Because obviously, I know that's a big aspect. When you're taking care of patients and you're producing the appliances in practice. There's a lot of steps thereafter to obviously ensure compliance and
Yeah.
fit.
I mean,
And
we've
so,
done in terms of revenue share. You're not actually technically allowed to do revenue share when you take Medicare, right? There's these things called
oh, sure.
kickback and Stark. So there's definitely regulation. So we pay a flat fee per day that they come in, and then
Okay.
we bill it out, and we take care of the lab fee obviously as well.
Okay.
And so my whole thing always is win-win-wins, right? So
Of course.
obviously taking care of the patient, it's a great ancillary revenue source in these days of reimbursement decreasing like all the time. Just finding other revenue source ancillary services definitely helps a lot. And then, the dentist is trying to get his sleep practice going, and so obviously this helps bring him patients as well. And then the second sleep dentist we just partnered with, he has a little different strategy. He has a 3D printer and he'll fabricate these in his office, and he's
Yeah.
also a TMJ guy. So he's going to be starting next month. And so I'm actually curious how his process goes. So like, I'm also learning different people's processes, right? Of how they do this. He's been doing sleep for a long time in his own practice.
Yeah.
And as well, so he's bringing in a different perspective. And, as long as our patients are getting taken care of in a very good manner, that's all I really care about.
Yeah, that's awesome. So both the digital in-house process as well as the outsource, or I guess in your case, you guys are using a third-party lab, or you fabricate them in-house?
Yeah, so far we've been using third party. Mostly we use Panthera.
Okay, sure.
Happy with that. But this new guy, he's does things a little bit differently. So yeah, we'll just see how that goes. But yeah, I think he's even likes impressions. So I like different opinions. Just like physicians all have different opinions.
Versus digital. Yeah.
We'll see how it goes there.
Yeah, there's a little bit of irony there in that you're using digital dentistry. The one is scanning and sending out to a lab or to your lab. The other is using 3D dentistry and in-house fabrication while not doing digital scanning, right? Old school impressions, be it alginate and or PVS. But in my world, the dental efficiency guy is always looking at operational efficiencies, and anytime you can bring something in-house, not only is the standard of care elevated, the delivery times are reduced, right? And then outcomes tend to, prognosis outcomes.
The new dentist, he gives the appliance that same day.
Yeah, that's
versus waiting a month. So I mean, he says
amazing,
always
right?
Appliance.
And that goes the same with same day dentistry and be it prosthetics, removable prosthetics, partials, dentures, and or long term temporaries, and even in some cases, up to like similar to Emax crowns can be done via 3D printing today. So some amazing things, but that's not obviously the focus of today. I love so do you know of any other cardiologists? Is there a movement, is there a niche in cardiology? I
I don't know anyone else in the cardiology world doing this, even though I think many more should be.
Awesome.
That's one of the big benefits of owning my practice. I know dentists basically, there's the private equity model and then the ownership model, but in medicine, especially cardiology, the vast majority of cardiologists are employed by hospitals.
Correct,
So,
yeah.
just the way the reimbursements have made sense, hospitals can get paid a lot more for the exact same work. And so about probably 15 years ago, there was a big movement from 95% of cardiologists being private practice to now, probably around 85-90% are now employed. And so they don't even get a chance to do all this stuff, right? Because this is all office-based. Hospitals want things done in their hospital, which is where the hospitals make money. And this has allowed me to think outside the box, right? So if I get some knowledge and I'm learning about these new modalities, it helps me take care of our patients, and it just makes things really interesting and fun as well.
Yeah, that's
So
beautiful.
in terms of cardiologists, I don't know. I know there's some ENT doctors, just because that is way more their mainstream specialty, that are bringing dentists in to do this. But again, the downstream effects are all cardiovascular that we want to prevent, right? So that's why I think more cardiologists should be. I think we underestimate the importance of obstructive sleep apnea in the cardiology world. So, whereas I probably test 9 out of 10 of my cardiac patients, that is not the case if you look throughout cardiology. We're focused on the echoes and stress tests and all that's purely right in the heart. That's what we're focusing on. I don't think we even do a great job with lifestyle, modification.
But not lifestyle cause, right? Changing the
Yeah, we don't do a great job talking about diet and exercise. Like one of the other things is, I have a dietitian and personal trainer. It's all covered through insurance that we offer our patients as well. So all our sleep patients, weight also plays a big role. So we try to get them, if they're willing, to talk with our dietitians. And again, it's all covered through insurance. So anything that's covered through medical insurance that we can help with their health, I'm all about doing. And so I'm all about holistic, multidisciplinary care. And anytime I learn of something, I don't, I think one of my benefits is just personality. I'm very open-minded. I tend towards action, right? Let's take the action and figure out later. Obviously, I'm doing some research to make sure it'll work out, hopefully, but I'm very action-oriented.
I actually I don't a couple days a week I do overnight oats. I don't do it because I normally do more of a protein diet in the morning, but for energy and to switch it up, I do it a couple times a week. Anyway, I share that with you because this morning when I opened my sugar-free apple cinnamon oats, it's called mush. On the backside this morning, there's always sayings on the backside of the lit. Start even if you don't know how.
Oh, and
Today. So if I could share it, it's on my phone. If I could share it, I would right now. But anyway, it's fascinating because, obviously as an entrepreneur, it's important to consistently have an abundance mindset in the way that you approach not only business, but service of your patients and or customers. And I think at times you can get trapped in the process of the delivery of care and not be working on the business. It happens in all business, especially in private practice, but you having the freedom to do what you want is the big benefit of private practice versus I in my past I've worked with hospitals, and the amount of red tape and the challenges in administration has to approve everything for it to happen can sometimes take a really long time.
But just because we're in private practice doesn't make this possible, right? Many people become a slave to their job, right?
Yes,
So they bought a
true.
very expensive job instead of actually being a business owner. So I think the mindset part plays a
great
huge
point.
role, and then also being able to and willing to delegate out as much as possible. Where my goal is always to practice at the top of my license, and to value my time at a certain amount. So let's say I value my time at $1,000 an hour. Like, I don't want to be doing work that's less than that. So I'm not going to be doing $15 an hour. So I'm going to delegate and hire out as much as possible. And one of the mind shifts frames that I've had to switch is twofold. One, if they don't do as good of a job as you, but they do 80% as you, that's fine, But the second thing is, ideally, you should be able to hire people that would do even better than you, right?
That is always the goal.
Yes.
But as we know as entrepreneurs, right, when we own a business, the thought that anyone is going to come in and have be vested the same way that you are in your business, I think is one of those misbeliefs that it's a hope, right? We think they're going to come in and be vested as much as we are. Now, people can work as hard, have other skills, right? And you level up areas of the business that are weaknesses or challenges. Yeah. But I think I did the same. I have done the same thing in my endeavors as well. Try to hire better than yourself. That may be another, again, in areas of weakness that we all have. But
yeah, I think that's been the biggest kind of thing that's helped me. Like, frankly, I have 7 businesses, right? And I'm able to do that. And not to get too much on a tangent, but I use offshore talent a lot, right? So offshore talent lets me experiment and hire more people because it just costs a lot less. And
VAs?
VAs, I have my own VA company, but they run my businesses for me. Like, my operations lead for my cardiology practice is in the Philippines.
Okay.
And she runs my practice.
That's awesome.
Yeah, so all these things are run. I have kind of my COO of my practice who is in the U.S., but then underneath that, all the different practices we have is run from offshore people.
Okay.
And so that allows me to spend money on marketing. That allows me to spend money on the dentist coming in. That
cost savings and efficiency.
gives me the ability to do that, and I can hire way more. So it sounds like I'd be like just dying with work if you have 7 businesses, but I'm not. It's actually I have a very good lifestyle for a cardiologist.
Awesome. I I guess I will ask because I know when you say that, right? Do you have a normal schedule, or are you a solo provider in your two cardiology practices, or do you have other providers?
Now we got other providers.
Okay, okay. So do you? I guess you I hear about the long hours in hospitals or in in facilities that are affiliated with hospitals at times. Do you avoid some of that as well? Being
Yeah, I basically stopped going to the hospital. I stopped taking calls. So when I first started, I was working probably 3 out of 4 weekends a month, running around to 5, 6 hospitals, taking care of all these really sick patients. But then once, you get kids and they get a little older, you want them to remember who you are, right?
yeah,
So, and then you don't want your wife to be upset at you, even if your wife's a physician, right? They'd stop understanding after a while. So, I was kind of forced to make the change, but looking back, I mean, I didn't want to give anything up, right? So that was also kind of a
sure.
shift I had to make. It's like, what, you want me to give up this hospital? You want me to give up taking care of all these sick patients? So I haven't given up, just cut way back. And frankly, from a reimbursement standpoint, the office stuff makes a lot more sense as well. Um, and then, because you're doing a lot of unreimbursed care in the hospital, right? So you're spending all this time away from your family, and half the time you're not going to get paid for it. People don't have insurance all the time, so those things I had to make a change. But yeah, my lifestyle is great. I do 4 half days of clinic a week, and I get to work out an hour and a half every day. I'm home by 5:30. So yeah, no complaints.
No, that's beautiful, and I would say I liken that to providers in dentistry when they are working for someone else and have the bug to open their own practice, but the fear of having to work multiple jobs, right? Do the dentistry and run the business and have the crazy long weeks is a real concern to starting a practice, and I think some of that holds fast or holds true in starting any business. But as you said, I often am recommending both using offshore talent or VAs to do busy work, as well as automate certain tasks out of the gate, systems and processes that can be automated today to allow your people to focus on patient care and impact versus redundancy and business processes where it's data entry or data manipulation or data migration. And even in the sleep process, now, besides SaaS or on the billing side, there are efficiencies that can be implemented that save time, save money, and allow people to be much more efficient. Again, the delivery, if it doesn't improve the delivery of patient care or patient care outcomes, it's probably not worth discussing unless it reduces the headaches in business in running the business, right? It's one of those three things when you're looking at implementing a system or process.
Yeah, it's funny you kind of mention because I talk a lot about the three things: delegation, automation, and systemization. Right. So I talk
Sure.
about that all the time, and I think those have been the keys. I mean, right, I have, and just one of my companies, like, right, I have the delegation company, which is a VA company. We actually have a SaaS company too, that we're working
Okay.
with that integrates with EHRs and helps with kind of patient engagement and some of that sort of automation and helping drive like a revenue engine that's
Sure.
automated.
Marketing, lead
AI,
gen.
so many things these days. And then we actually help practices develop SOPs as well. So I kind of do all three.
Medical practices? Interesting. Yeah,
Yeah.
yeah. That's awesome. So good to know. If Dr. Shaw, if someone wants to, wants to set up an arrangement like that, did any of the dentists reach out to you, or did you find the dentists to bring them into your practice? How did that work?
The initial dentist was actually through a connection,
Okay.
through
Yeah.
our home sleep test device.
Okay.
And
Sure.
then the second dentist, I actually, funny enough, just went to the AADSM website, this dental sleep medicine website, and just cold emailed a few people that were in the area and met them, met two or three, and me and this guy kind of clicked the best. And so, we've been talking for a few weeks, and then decided that, yeah, why don't you come in? And he knew the sleep doctor that we have. He's been working with her for a few years anyway, and
Wow.
he really likes her. So yeah, that's how that worked out.
Again, going back to the abundance mindset as an entrepreneur, right? You mentioned working at the top of your license. I always tell people to have a beautiful day. It starts with a beautiful mindset, right? Set the frame with intention of what you want to achieve, and that is also the biggest impediment to action,
Right.
right? Where action is the bridge between where we are and where we want to
And this is the
go.
reason I love like owning the business so much. It's not. I mean, their financial rewards and stuff are there, but just like the amount of stuff I've learned, the number of people I get to talk to, right? I would never be talking to you, for example, if it wasn't for this.
I told you this, I've never had a cardiologist on the Dental Efficiency Playbook, and the massive benefit. Again, I talk to people who are sleep dentists. I have worked with ENTs, I've worked with pulmonologists, uh, that they develop relationships. And the key in having a successful sleep practice in dentistry is having all the referral channels from both the sleep test providers as well as the medical providers, and developing those relationships in time, and then having the continuity of care or the communication consistently between them, so that the medical providers know that their patients are taken care of, and with the oral appliance again versus the failure of CPAP and the reason they get referred in the first place most commonly.
Right,
Um,
exactly.
so, but I think it's massive for a lot of reasons, because you reached out to the dentists. um, how many practices are using either their home sleep test? I've worked with a few different ones, but reach out to that individual and ask about cardiologists in the area. Do you have a cardiologist near you, or a private? I mean, again, as you said, I think it's few and far between to find private cardiology practices. But can you find private ENT groups? Can you find private mixed specialty groups that have pulmonology in there, and/or ENT? So just something to think about, and taking them out to
Yeah, I
lunch.
mean, yeah, exactly. One of the
Okay.
dentists I know is really trying to get her TMJ practice off the ground, and she
Win,
hasn't
win,
been able
win,
to.
right?
Yeah,
As
she
you
hasn't been
said.
able to, and like I told her, go meet with the ENT docs. Just go to lunch. I mean, pick up the phone and call. I mean, it's not that hard. Like we want people coming to us and hey, this is my card. Call me anytime, anything you need.
Yeah.
Right? I don't know if you guys have this in dentistry, but in medicine, it's the three A's that are important for success: affability, availability, and then ability, with the number one being right affability and availability, right? If you're a nice guy, if you're available to take phone calls, you're gonna get those referrals, you know.
Wow, that's huge. So one more time, the three A's: affability,
Affability,
avail,
availability, and then
mhm,
ability.
ability. Okay. No, I like that. I don't believe that in my career I have heard it coined that way. But I really like that. So if it's new to you, you heard it first on the Dental Efficiency Playbook. Thanks, Dr. Rishin Shah. So Dr. Shaw, if anyone wanted to get in touch with you, be it for care or questions, or our listeners are largely going to be dentists and dental groups, or dental entrepreneurs, so people in the industry.
Sure. For my practice, it's called Prime Heart and Vascular. We're in the Dallas area, so that's primehv.com. If you want to learn more about our virtual assistants and delegation, that's golean.health. And maybe one of these days I'll actually set up my own personal website so I can give you my personal stuff, but we'll get there.
Awesome. Awesome. No, thank you so much again. And Dr. Shaw, I always, towards the end of our recording, thank you so much for taking the time and joining the Dental Efficiency Playbook. It's truly been an honor. One thing that I always ask my guests, if there's one thing that you want to leave the listeners with, something to think about, to chew on, or to act on, what would that one thing be?
Yeah, I think it's a blessing to be able to have your own practice. I know it's a lot of headaches, it's a lot of hard work, but you put in that action, you put in that work, you're going to have a great time. So any of your listeners that are thinking about switching from being employed to owning their own practice, it's the best thing I've ever done. I would never go back and do the beginning again, frankly. It was really tough. But looking 8 years ahead, yeah, it's one of the best things I've ever done.
Wow, yeah, that's absolutely great. Heck of a nugget for everybody. So, thanks again, Dr. Shaw, and for all the listeners, thank you for joining the Dental Efficiency Playbook. We'll catch you on the next episode. Hey, friends, before you head out, I just want to say thank you. Seriously. There are a lot of places you can spend your time. And the fact that you're here with us, investing in getting better, building smarter systems, and elevating your practice, that matters to us. If today's episode brought you value, please do us a quick favor and like and subscribe. And share it with someone on your team who's ready to level up alongside you. That's how we keep raising the bar, that standard across dentistry, together. And if you're ready to take what you learned and actually implement it in your practice, head down to the show notes and connect with us through the link below. We'd love to help you streamline, grow, and create a practice that runs with greater efficiency and a whole lot more ease. Until then, keep focused on 1% better each day and enjoy the ride. We'll catch you on the next episode of the Dental Efficiency Playbook.